Hello, everybody, and welcome back to the show. This episode is brought to you by The Wellness Paradigm, a holistic health coaching company shifting the way that women understand and heal their bodies. Through bioenergetic testing, functional lab testing, and functional nutrition, we uncover what traditional approaches often overlook. So you can stop guessing, start healing, and finally feel like yourself again. No more one size fits all protocols, just real answers, deep rooted healing, and the clarity and confidence you deserve to feel incredible. It's time to shift the paradigm of women's health. Now, onto our show. And good afternoon, Maureen.
Hi.
I am so grateful that you are here, guys. Maureen is just a wealth of knowledge, incredible, and I just cannot wait for her to share all of her knowledge on women's health with you guys. She's a women's health nurse practitioner who's really just providing care for women. I think you mentioned it earlier, from 12 to 102, kind of in all walks of life. And she's just gotten so many beautiful compliments and patients that come back to her all the time, like, gosh, you actually listen to me and you care, and your view is so different and comprehensive than a lot of other, people out there. So I can't wait to dive in. Please tell us a little bit more on who you are and how you kind of got started, working with this population.
Great. Thank you so much for having me. Yes, I'm a women's health nurse practitioner. I started out as a bedside nurse in gynecology, oncology, and then went to antepartum, postpartum, and really developed a passion for that. And in the gynecology, oncology world, definitely decided I needed to go back because I was obsessed with the health and longevity related to the female body, particularly, and knew right away it was not going to be just a general nurse practitioner. It was going to be a women's health nurse practitioner. And I've been doing that since 2009 and have really loved every minute of it in terms of providing basic gynecologic care, providing education on contraception, really looking at the whole patient for menstrual management, menopausal care, perimenopausal care, and really focusing on keeping women as healthy and strong as they possibly can be, with the end goal being keeping them out of diapers and out of a wheelchair for as absolutely long as possible.
Mm, very good goal. And, I think you mentioned something that's really important to understand as you look at the body as, as a whole, right?
Mm-hmm.
Oftentimes this can get a little bit, I don't want to say demonized in the medical world, but it's like, just compartmentalizing too much. So when you talk about looking at the woman as a whole, when a woman comes into you, what are you kind of addressing, when they first come in? And what are maybe the main complaints that you see as well, although I'm sure they're across the board?
Yeah. Um, uh, Main complaints are just like pelvic pain, and they
Okay.
don't know why they have it. They can't explain it. And, they've been seen by their PCP. They'll have a negative pelvic ultrasound by another obstetrical provider. And they may have even gone to see a GI doctor, but they really feel like there's something wrong and they really are feeling physical pain. That's a big one. Another one is just recurrent vaginitis.
Mhm.
And that really is related to this, incredible knowledge deficit about the vaginal flora and how we are making a few men very wealthy by over cleansing down there. So those two are really big ones. And then really managing their periods, and then fatigue. I would say those four things are really things that are so important to tackle and have so many factors that are involved. And it does get me excited because I'm like, I have a couple things I know that might help you feel just a bit better. And
Mm.
so I get a fire in my belly and I'm ready to go with those people.
It's you can tell always just like the passion that you have for helping people and just how like lit up it makes you. I just love it. Fatigue is such a big one. That's probably one of the biggest things that people come to us for too. And it's, gosh, it's so complex to an extent because it's like, where
Mm-hmm.
from? But particularly as it relates to women's health, I find that most women don't understand their cycle. that sometimes we might be a little bit more tired, more energized, more, sexually driven, more, you know, more nonchalant, that those are actually like normal things that are happening. We're not
Hmm.
about that, a lot of it's just suppression, whether it's via prescription or whether it's just the way we are, don't be a woman, be less.
Right.
Do you see some of these kind of like maybe lack of knowledge or education kind of creeping up? And is that something you kind of help clients a little bit with? Because I know there's only so much time you have with these people too, right?
Very true. I would say I the time thing is quite interesting, and there's definitely after I've spent the good part of the visit really trying to focus on active listening, um, and really creating or participating in a sacred interaction. And every interaction is sacred, and really giving them that first half of the visit to really listen and watch and learn from what they're saying. And I would say if you're a patient who's coming to me and you're like 35 to 55, I'm like, well, we were ruined from the start. I'm 44 years old, and I feel like when my generation was in middle school and high school, we were told we would be happy for the rest of our lives if we ate SnackWells and drank Diet Coke. And so we already have, slowed our metabolism and created some inflammation just by the world telling us what we should eat and what would make us happy if we would be happy if we consumed those things. So I always try to tell women, listen, it's absolutely not your fault. You were doing what you were told, you were doing what media and the world was telling you should be, but we've screwed ourselves over.
Mhm.
We have a lot to come back from.
Yes.
And so cut yourself some slack.
Hmm.
It sounds like you're making some great efforts on trying to get your energy levels up when it comes to fatigue. And it's the hardest thing in the world is to tell them you actually have to eat, and you have to like eat protein, and you have to eat it throughout the day.
Yep.
And protein tells your cute little brain to get out of fight or flight. And I think that concept, really wrapping their heads around that concept, is really difficult just because, again, they've been told for years that no, live at a calorie deficit, eat as little as possible. So I think that's my biggest challenge, patient to patient right now.
Oh, I mean, I can tell you as someone who's on a metabolism, very focused women's clinic for years, telling clients to eat more is one of the hardest things because it's retraining, repatterning generational things, particularly if you grew up in the 80s, 90s, where it was like, fat's the devil and, everything's low cal and then the early 2000s where it's like everything's high protein, but it's like the wrong kind and we're just adding it or just adding a bunch of additives to everything and everybody's bloated and gassy. So,
Mhm.
that's a hard rewiring and especially again being in your kind of space, which is why it's beautiful how to have collaborations too, right? It's like there's only so much time that you can have to understand the female cycle, to understand nutrition. What does eating more mean? What does protein mean? People have never even heard, like, okay, is that just a chicken breast? Do I just eat chicken for the rest of my life too? It's like,
Right,
no,
right.
it's
And
different.
as a nurse practitioner, I feel grateful. My training at Columbia was intensive. It was comprehensive. I did get menopause training. I got some decent nutrition training, but those 20 to 30 minutes I have with a patient is not enough. But I
Mhm.
do think I have to do my part and tell them, well, you got to do more of these things. And I'm here to start to tell you, you got to start to switch your thinking. And then definitely having great referral panels to tell people to go to or to give them a resource. So I feel like, for instance, your training and your knowledge and your passion is perfect in terms of we need a place to send patients so they can get this one-on-one time. They can get some more encouragement, some more coaching and education on exactly how to change their thinking and what to do with that change, how to make it happen, how to functionally do it. And I do think, I mean, I wish medicine was where my office was right next to your office,
Yeah.
and they would see me and then they would see you. That would be beautiful.
It would be. And I've seen a shift with some of this. Unfortunately, sometimes it still is like you get to see maybe a dietitian by a hospital, which is still good, but it's still a little limiting, honestly, with what
Mhm.
they can tell you and the amount of depth that they can go into. Because a lot of it is not how much to eat always. It's the repatterning, it's the habits, it's it's the neural training, it's the nervous system dysregulation that everyone's in this fight, fight, freeze,
Mhm.
severely impacting not only, things like metabolism, but our hormones on a deep level and pelvic floor muscles. I mean, I've seen when people release certain trauma and certain nervous systems, suddenly their pelvic floor pain completely goes away after years,
Mhm.
you know. But there's only so much you can get through, um,
Yeah.
at a certain time, but it's so multifaceted, right? And it's important to understand that there's all of these. I've had so much nutrition, pelvic, nervous system rewiring kind of work, and you still have to see somebody physically, you know,
Yes.
very much a physical element too. It's like we oftentimes, even in the functional health world, it's this is the only way. This is the main way. This is the only way. It's
Mhm.
like we need to oftentimes have multiple approaches and multiple viewpoints. Um,
Absolutely.
you're going to hit home with a lot of different people, which is why I think people like you so much too, is not only what you say it, how you present yourself, and how you care, you know.
Mhm.
Um,
And you really, and if you don't have it, you got to get out because it's just a waste of everybody's time and energy. And I feel like right now we have such a great momentum in women's health and women's care that we're at a great place in terms of, I feel like patients and consumers and clients are at an advantage right now because the people that are in um, women's health right now really want to be there and really do care. I think part of it too, like when I talked about pelvic pain, when it talks about the central nervous system, when you talk about kind of how you're feeling about it, I know, and the most amazing OBGYN surgeon's going to know that she's not going to have an ovarian cyst. It's unlikely that she would have an ovarian cyst. It's unlikely that she would have a massive fibroid in her uterus that's causing this pain.
mhm,
But part of that rewiring and part of that thinking is meeting them where they're at. If she needs a picture of her uterus, if she needs an ultrasound so she can say, okay, I feel better now. I can be calmer because I know that
mhm,
anatomically I'm okay. And Maureen's telling me, oh my gosh, your pelvic pain is likely your central nervous system and it's musculoskeletal. Let's start somewhere. Let's do some pelvic floor physical therapy because you've been holding so many things in tension because you've been uncomfortable. Let's start to loosen that up first. At least I know I can get you there. I will place the referral. They're all female providers. They're lovely people who have a tertiary certification. They know every muscle, tendon, and ligament of the pelvic floor.
mhm.
Go see them, you know? And so sometimes you have to meet them where they're at, and especially if the patient is a visual person and need that reassurance, they deserve it.
Mm.
Yeah.
That's so true. I love what you said because it's like, yes, we know, and let's just help them feel better about this too, because that is half the battle with women's health, with health in general, is feeling that sense of calm a little bit,
Yeah.
and like through a little bit sense of calm, we can start to heal, you know.
Yeah.
And if you're
And we signed up to help people feel better.
yes, yeah,
That's what we signed up for, so we just got to do it.
100%. I'm curious about two things. I'm gonna kind of pivot from pelvic floor to two opposite, they're not really that opposite, but I want to talk a little bit about these reoccurring infections, vaginal infections.
Yes.
This is not talked about enough. It is so freaking common, and I see people all the time who are coming to me, all these gut stuff. I'm asking them, have you had antibiotics before? Oh, yep. I'm just on a recurrent antibiotic every day for, recurrent BV, or, I'm on this continually. I'm like, oh, let's try to figure out what's going on here. So let's talk more about this.
Okay, great. It's so sad because just now, well, as of 2022, I know the International Society for Vulvar and Vaginal Diseases is this incredible society, but they have so many passionate people who are really, really looking into the vaginal microbiome and really studying all of those things. And I am thrilled. But at the the international conference in Ireland a couple years ago, a gentleman stood up, and I wish I could remember his name, but he was like, listen, I'm a male, I'm white, and I'm really, really rich because your patients over cleanse. And he was like, I'm saying this so you don't forget it. Like that you need to go tell your patients to cleanse with water. And I was like, oh my God, I think I had my first hot flash because I was just got so I like wanted to punch him in the face and then I wanted to hug him. You know what I mean? Like I was like, oh, oh, oh. But it's, I mean, it's true. Like we all knew it, but the way he said it was so good where it's like no one was going to forget that. You know,
Yeah.
if you're a new OBGYN, a new Urogyne, a new nurse practitioner, she was going to leave and be like, I am not here to make any man more money. We love men. They're great. But it was that part was wonderful. And I'm still shocked for as many patients as I see and as many patients as I tell that to, they roll in and are like, I'm using this feminine wash. I'm doing everything right, Maureen. I mean, the knowledge deficit about what to put down there is so huge. And I want to get really, really rich so I can just like rent billboards everywhere and put that on there. Yeah. Yeah.
Love
So
that.
yeah. So the over cleansing for sure. And then it's terrible. I myself had a very serious illness in 2018. I had had a surgery and became septic afterwards. I was in the hospital for 4 weeks. I had a PICC line after that for 4 weeks of IV antibiotics. It was terrible. It was very scary.
Mm.
Um, and I remember going to infectious disease for the follow up, and I looked at this resident and I was like, I'm pretty sure I have a yeast infection, like because I've taken all these antibiotics and I'm a big baking soda bath, natural boric acid gal, but like I'm gonna need some diflucan. And she's like, well, how do you think you got the yeast infection? And I'm like, you're the infectious disease person. You should absolutely know that like you've killed all the flora in my body, and then yeast, being its cute little white flowers, they bloomed. They
Mhm.
bloomed. There was no cute, there's the yeast is the flowers, and then our good bacteria are like the gardeners. And the gardeners left and the yeast overgrew, right? And so I just looked at her like, oh my God. And she gave me the hardest time about like needing this, even though I didn't want to take it. I was like, I gotta treat myself. I gotta do something about this. So I found that to be shocking when if why wouldn't an infectious disease group say, oh gosh, we're going to be giving you these antibiotics. We want you to take this probiotic. We want you to maybe do some digestive enzymes. We want you to eat these foods, and maybe take these supplements along with it because this is likely to happen. And
Yeah.
we're just not seeing that. So, and I see that all the time. They roll in and they've just taken something. And so that piece really kills me too, especially women who have some more serious things that they need to be on suppressive antibiotics for, or vice versa, or women who have newly diagnosed diabetes.
Mm.
And the endocrinology has not dipped their toe into kind of like the whole body and how it can be affected.
Mm.
Yeah, because they'll get yeast. They will. Yeast love sugar.
Mm. And that's, I mean, yes. Yes. That makes so much sense when you say it, but yet it's just we're not taught this. And I will say I've seen some providers who have been like, make sure to take a probiotic, right? We kind of know take a probiotic with your antibiotic. And there's multiple issues with this. One, do they already have dysbiosis going on and we're kind of fueling the fire even further, not only with the antibiotic, but with the wrong strain of probiotic?
Sure.
And that could be, throwing fuel to the fire, but also what we have in stores is not that great for probiotics at all,
Mhm.
and it's very limited. And so you go to the store and you're like, well, my doctor said a probiotic, and this looks good. This is number one recommended by doc, right? But then like certain strains like Saccharomyces boulardii is very helpful for like antibiotic associated diarrhea,
Mhm.
right? So if you're having this, it's like, but I'm taking a probiotic and it didn't work. It's like, well, let's just switch the strain to something
Right. Right.
not a 20 million one because you think that's better. Let's do a 5 because that's also like like way easier on your gut, as well, and more specific
Sure.
on strain. So it's like there's so much, and again, that's something I'm expecting a doctor to understand too. Like, right, we all have our time and place, but it's something to note when
Right.
you're like, I did the right things. Yes, and
Hmm.
we just need a little more education on how to make it a little bit more right for your body.
Yes. Yes, absolutely. Yep. And I also feel like really getting them to understand like these feminine washes,
Mm,
yeah, they're not going to kill you if you're feeling symptomatic and you use it once or twice, right?
yeah.
But if you're already feeling symptomatic, it's going to slow the healing even more because it's killing all this protective stuff that you need. And I feel like I wish when I was in school, or I wish again, same thing that, okay, well, I'm treating a patient for a yeast infection. What what supplement should I tell her to take? Should she take a probiotic and what kind? You know what I mean? And like let's say it's somebody who has, not a significant like inflammatory or GI history, just some adorable gal. We'll say she's 26. She's tried to treat her yeast infection with monostat 3-day over the counter. It's not working. She has a positive culture, which smart girl, she actually said, no, swab my vagina. I don't want to take anything I don't need. Send it off. And can you let me know what strain's growing? Good for her. But then for me, it'd be like, cool, I sent off your swab. It's this strain of yeast, very common. I would love to be able to say, well, since you've been symptomatic for 6 months or longer, we should do some like a medication.
Yeah.
And then how can we support your vaginal tunnel after that with the right probiotic and the right like vulvar vaginal care? And I feel like for me, the tool I have is washing it only with warm water, avoiding sugar and alcohol.
Mm.
Start with a baking soda bath, 1 cup, soak for 10 minutes when you're feeling symptomatic. If you really want to go the natural route, boric acid is it's local treatment. You can treat a yeast infection nightly for 14 nights. You can treat BV nightly for 21 nights. That sounds very intense, but it's great because it doesn't screw up your the rest of your body, and it helps keep the flora healing and balanced while you're doing the treatment.
Mm.
And I think patients really appreciate the localized approach and are willing to do the work, right?
Yes, especially if this is not their first time too, where they're like, oh gosh, I don't want this to happen again. Like, you know.
Yes. Yep. And then when we talk about suppressive therapy for vaginitis, again, doing things like really focusing on eating healthy and avoiding sugar, letting her breathe. Let her breathe.
Yeah.
Loose shorts with no undies.
Hmm.
Overgrowth of bacteria and yeast like dark and damp. Let's make it like not dark and damp. Like let's just not do it. And then I think the most natural thing I have that really doesn't disrupt everything else would be a suppressive therapy with like weekly boric acid. That is really helpful. And there's so many great companies out there that make a decently clean product. Many women own, women run, which also is wonderful. And again, it's localized. It's not disrupting. It's essentially healthy because it's keeping things balanced, and it's something the patient has complete power over themselves, and they can buy over the counter now and order online. So I really like that piece for the recurrent vaginitis. But that's where my kind of clues end because I'll say, yeah, take a probiotic that's for vaginal health.
Right.
That's all I've got. And I will say, I feel like that gets patients there a chunk of the time. Like for some people, it can really work, but then there's others who come back in tears and are like, I want the 21 test panel done. And
Mhm.
I want this and I want this. And I am miserable. And my self esteem is the size of a pea because I feel like a walking symptom every day.
Mhm.
Yeah. So I feel like I have some tools for the reoccurrent infections in terms of don't over cleanse,
Mhm.
local therapy, take a probiotic, let her breathe.
Yeah.
And
You know,
it's more than I think a lot of people get, but it's still not enough.
oh, absolutely. I mean, I've had so many clients, it's like, well, just take another antibiotic. That's duh, right? And it's like,
Yeah.
but no, I don't want to have this again because this is my 6th month that's here. It's like, um, No, that's interesting, and I'm curious if there's been more of a conversation around um, maybe not around specifically microplastics or just around, the impact of these certain fabrics on, uh, on
Sure.
on our female parts and how important it is to potentially swap out fabrics for something more breathable. But is that something that's kind of becoming a little bit more accepted?
Yes, I think so. I think generationally, I am seeing my younger patients coming in with a sense of duty to self cultivation and self care, and younger patients demanding knowledge. Where I feel like I was very accepting of the fact in fifth grade, I was told how to use a pad, and I was like, okay, they told me everything I needed to know. Things are going to be great. And I figured out how to use that pad after one try. I'm set for the rest of my life.
Mhm.
Where there are definitely younger and younger patients coming in and really wanting, you know, just vast knowledge of like, well, how can I make myself healthy so my periods are, I can turn down the volume of my periods or keep them not too impactful on my life, and what should I be cleansing with, and if I do get a yeast infection or if I feel itchy down there, what should I do? So I feel like they're definitely asking more questions, and definitely know like they're taking on the responsibility to really get to know themselves and their body, which is really really cool to see.
It is, and that's for better or for worse. Social media is a big
Mm,
And, I say for better because yes, people are more educated. And I say for worse because more and more and more and more people all have hormone issues. Everyone's
yes.
got a hormone issue. So we talk about it more. And, we're just not educated on how, like, I mean, I know growing up, if I was throwing up and having, clotting and bleeding for a ton of days, I was told that was normal. This is part of being a female. And then when it would skip for months, it's fine. It's normal. It happens. And then
Hmm.
no, it's not
Right. No.
like this is like your cycle is one of the biggest factors on your overall health as a female and how well your body's functioning, as
Hmm.
fertility, whether you want to get pregnant or not, how everything is working is a proper metabolic and just overall function. And more and more women are just having their lives ruined by
Yes.
horrific pain around their cycle. And it's every month. It's not like, oh, I get this occasionally, right? It's like every month they deal with the same old crap, right? And it's
Yeah.
horrible. And there's so many tools now to understand why this is happening and how to fix it instead of just,
Yes.
which isn't a bad thing if that's the right,
No.
but
Right. Because I feel like in some cases birth control like saves lives, but it is interesting generationally too, because I'll have a mother and a daughter in the exam room, and the mother will be like, I just dealt with it. I just dealt with it. Like she's just like, I brought her in so you can tell her that this is normal. And I'm like, well, like normal that she's like not going to die. But I feel like you're telling me she's missed 24 days of school this year. And this child could potentially be the one that finds like the massive cure for a cancer, but she's missed so much school that she won't be able to do it. And the mom's like, right. And I said, there is a range of things that we can do, starting from just like foods, supplements, and all the way to doing, a low dose progesterone IUD because she is in fact anemic and her ferritin is 8. Like, so, and the mom's mind was blown and she got tearful because she was just like, I just wish I had this for myself. She's like, you're telling me that I need to give her vitamin D and some potassium and try Vitex. And you know what I mean? Like, and she's like, what the hell's Vitex? I'm like, it's the cool stuff that you can buy. And we just have to figure out the right one to buy because there's so many crappy supplements out there.
true.
And she came back 90 days later, doing the list, eating more protein,
Mhm.
trying some supplements, and really, really feeling better. And felt like a 16-year-old girl was like, I'm starting to like my body again. And I was like, that's the goal. Thank God. And that was like so wonderful to feel as a provider, because like that's again, we signed up to take care of people, and I feel like it's something that happens every month, just like you said. And if we can just lower the volume on it for some people, what they're capable of and how they feel about themselves could be huge.
Oh, that literally life changing. I mean,
Mhm.
that's amazing. And it's amazing that you have those tools to give people too, instead of like, well, birth control. That's literally, I mean, so many clients come to us with pelvic or, PCOS, PMS,
Yeah. Yeah.
all of the things, right? And it's like they were like, that was the only thing my doctor ever talked to me about. And then they shamed me when I didn't want to go on it. Or they shame me when I want to go off of it. And the only solution when I was still having issues, which duh, if you get off of it, but you don't fix the underlying root, just not going to go away. When I don't want to go back on it again. But something you tapped on, I want to quickly talk about is this kind of generational thing where people come in and say, I dealt with it.
Hmm.
It's really important because we live in a more toxic environment now. And that's just the reality, right? Like our food is
Hmm.
different, our environment is very different, and what we put in our bodies is just different. And our toxic load and our stress is different. And so it's, yes, you might have dealt with it. And I'm not saying it was fine and dandy back then, but I can guarantee it's probably different now for so many people too, right? And
Right.
I think that's something I hear a lot. I dealt with it. And,
Hmm.
our lives are different and we need a different approach now because it's like, well, I didn't need all these supplements or I eat the food fine back then, but it was all different. It was all very, very different. And it's unfortunate that it is the way it is. And it's okay because we have tools to kind of help combat it because our world is toxic in many elements. I don't mean that.
Hmm.
So, yes, I felt the need to kind of just tap on that just for a hot second.
Absolutely. And then I feel like when they're in fifth grade, you need to just write a book
Yeah.
that they should be given on, the food, the supplements, and things they should be taking.
Yeah.
We still need the pad, but then we need your book. And then I need to roll in and talk to them really about um, self-cultivation too, in terms of like what your hormones are doing. And, men are told masturbation's totally normal in fifth grade. Like they get the talk too, but they're like, hey, if you masturbate, it's totally fine. Girls are never, ever. That's not once said, you know, all those things. And so I would roll in and I would figure out a very, very cool way of saying it, and a very like PC way of saying that piece to really affirm this self-cultivation piece that women deserve to hear and deserve to know that that is normal. Self-care, self-pleasure is normal. And also eat these foods, take these supplements, because then your periods are going to be quieter and you're going to like yourself better. You're going to be able to focus more at school and work, and your mood will stay, your mood will be able to withstand all of this overstimulation that we're getting, right? Wouldn't that
Yes.
be great?
I just talked actually with a friend about how we would go in and do like sex ed different or even just something simple like like free courses for women to just give them this education because like something so simple. I will tell you, I have had clients switch to organic tampons and have had 50 to 80% less pain in their period. That one swap or switching to cotton underwear or something like that. It's like
Yes.
yes, it can be more complicated. Yes, we might need some dim and chaseberry and, all these. And sometimes, can we just breathe for a hot second? Can we just, can we learn to breathe? Can we
Yeah.
not take, cross boundaries every second that we get? Yes, I know your period's hurting you, and this other thing is, I promise, is factoring into it. Can we just eat? Dairy's a big one for a lot of people, right? Like, just if somebody would have told me eat a little less dairy and less inflammatory foods, I wouldn't be on antibiotics every day of my life for cystic acne that we're on and birth control to calm my acne, right? It's like
Right.
stems from the inside. Can we just drink a little dandelion tea in the morning to help with some liver health? You can do that starting in high school, right? Something so
Right.
simple that can
Hmm.
make a world of difference to heal from the inside out, and just learning about the female cycle too, like learning there's four phases of your cycle and what this means. I talk about this a lot. Maybe I could send you an episode. You could put it somewhere to just have people listen. It's like a 15-minute episode. It's just like, what are the different phases of the cycle? How are you going to feel? And how to eat maybe a little different, how to train a little different so you don't feel so bad about yourself when one day you feel great and then you're like, wait, 2 weeks later, you want to, suddenly you're yelling at somebody for putting the dishes in the dishwasher the wrong way. It's like,
Right.
okay, there's things that are happening. You're not crazy, but there's ways to stabilize this a little bit and just learn certain things are normal, right?
Yeah, certain things are so normal. And for that adorable 12-year-old girl in the early stages of puberty who's progesterone dominant and she is just so sensitive and she gets so angry. And then the shame she feels because she's so sensitive and so angry is such a sick cycle, and it can set her up for so many bad feelings when if she just known, well, I'm progesterone dominant right now because I'm going through puberty and I'm going to, rude is ugly, but and I shouldn't be rude to people, but I am really feeling the feels and it's okay. And then for her mother to know, hey, she's progesterone dominant. Usually when that happens, you're the person you feel the safest with. So just get ready because she's going to let you have it because she feels so safe with you. So just remember it's because she loves you, but I mean, I just feel like I wish that cute 12-year-old girl would be like, I just wish I want to tell her it's all good. Just don't cuss at your mother.
And have a little more magnesium in the process. Just
Right. Right. Sure.
both for the
Quiet your central nervous system.
the parents and the kid. Yeah. I mean, that's
Yes. Yes, both the mother and daughter should take it.
both.
Yes. Yes.
I mean, such simple things. And, granted, yes, we can overcomplicate this. And yes, I've been on some really intense protocols with clients. And most people need some extra nutrients in their diet. They need electrolytes. And most people need a little extra magnesium. And it's like, oh my God, that's why you crave chocolate, guys. Chocolate's high in magnesium. And you need that in the latter half of your cycle too, right? Like,
Yes.
when, changes a little
Yes.
bit in that latter half of the cycle, you do have more cravings. That's okay. Nothing's wrong with you. Your willpower's not out the window. Learn more.
Yeah.
But yes, I think the education, not just for the person, because, when you're 12 too, you're not buying your tampons typically, right? You're not buying certain things, your food, right? It's like, it starts with the parent. I mean, this is why I'm so passionate too about working with people. And I work primarily many with moms, right? We pass
Yes.
our children too. And like, it starts with you, right? Not just from a gut microbiome standpoint and how you pass that on to your children. And that could increase your chances of, your children having issues
Yes.
like our education and our knowledge. So,
Right. And you're reminding me that I have just a huge opportunity here in terms of like just social determinants of health here by staying true and encouraging these women because they will pass it in a good way onto their children, like by making sure they're doing all these things and telling them they should. And here's why.
yeah. And it'll change the
Excellent point.
process too, right? I mean, unless they're in menopause and then, they aren't getting anymore. But although many of the things are still relevant, as far
So
as,
relevant.
um, but yeah, I mean, it's amazing. I mean, you change their life, and when you're a happier, healthier person too, your nervous system is more regulated, and you pass that on to your kids too, and they get
Yes.
that. So it's so much more than just how you feel. And I mean, this is such a compounding ripple effect.
Yeah. And that makes me think of two things. One, when I teach the postpartum support class every month, I always have this picture that has all of this, like the parenting section of Barnes and Noble.
Mhm.
I'm like, I bet all of you have read these books on like the milestones your child's supposed to meet and the food your child's supposed to eat. But like, I'm here to tell you, if you aren't taking care of yourself, there's no way you're going to put forth any of the information you read in this book.
Oh,
And then secondly, I had this menopausal specialist say, if one more patient comes in and tells me they spent more on, the chicken coop they keep or the 3 dogs they have than they do on themselves, and they're the person that provides care for not only those beautiful animals, which we should all spend money on our animals and take care of them, there's no question, but when you're telling me you're investing more time and money on that than your own self, what's actually happening here? It's just all you're do. It's all just it's leaving you, and you're going to get less and less and less in every way, and feel more bad things in every way. And I just thought that was just kind of powerful, in terms of stop reading books on taking care of your child, put that down, go eat some protein, drink some water, and talk to a nutritionist. Okay. And every time you spend money on your dog, you better be spending that same amount on time and effort and care for yourself,
Mhm.
like on your actual health. And yes, get your nails done too. Fine. Use something organic.
I mean, that's so true. I mean, I obviously have this conversation on the daily, with
Yes.
and then it's like they're scared to invest in themselves, and
So
it's
much guilt.
so much guilt. Oh, I could be giving this to other people, or I could be doing other things. Or really, a lot of it is rooted much deeper into I don't feel good enough. I don't feel worthy. I don't think I can stick to it. I've tried things before and I failed, right? We can get into all the psych stuff, but it's like, but don't you realize your whole life and everybody around you gets better?
Yes.
You don't need another set of clothes right now. Your dog doesn't need another set of clothes. I've seen that too, right? Or
Right.
it was like, you need a new bra, probably. Like, let's be real, you probably need a new bra. And you probably
Yes.
need a little bit of education on how your body is working and changing and shifting because what was working in the past is not going to work now. And stop fighting yourself and telling you something's wrong or that you're broken. You're not, you just haven't figured out a way to adjust and adapt to the body at this current moment, right? And it's just figuring that out, and your whole life gets truly better. Your relationships gets better. Let's be real, your intimacy gets better if that's,
Mm.
your relationship gets better, your kids, relationship with work, career. It's hard to do it all as a woman, right?
Yes.
Especially if you're work, I mean, especially anything, but if you're trying to grow, a career and then also at home, shoot, if you're a stay-at-home mom, kudos to you too, because that is a whole nother,
Hmm.
it is hard
Yeah.
and to maintain relationships and health. Get it. But it gets easier when your body's not fighting an uphill battle every day. So,
Yes. And that's also something that needs to go in the fifth grade book. Your
yes.
body will change. Your body and your brain makeup, it will change. And that is part of life. That is something that will absolutely happen
Mhm.
no matter what you do.
Mhm.
And I just feel like that's the other anticipatory guidance we never got,
Mhm.
because I have patients after patients who are like, come in and feel like the rug's being pulled out from underneath them because they're feeling these drastic changes, especially going into perimenopause and the menopausal transition. But it's like they feel betrayed. They feel like they've been slapped. And I
Mhm.
feel like if just, yeah, I really wish, yeah, when I was 5, just kidding. My mom would have been like, listen, Maureen, this is what's going to happen. You need sleep. You need these supplements, and you need you need to practice self-care. And when you're 2 days before your period, don't plan anything important to do. It's just what your body and your mind are going to need. I really wish she would have told me that, but she didn't know to tell me that either. Yeah.
No, no, but imagine how much less crazy you'd feel and just like more at ease with your body, right? And instead of like fearful almost, right?
Yes. Yes. Fearful. Because typically I feel like with women, when we are scared, or overwhelmed, and our cortisol levels like already high, and cortisol is a whole thing, right? But we tend to as women, especially midlife, I feel like it really presents itself as anger. And that's the last thing any woman wants to be, right?
Hmm. Oh,
Yeah.
and you can, well, ugh, I won't go down too far into this rabbit hole, but like anger, and your liver are very much coincide with each other. And, the liver it helps with detoxing. And when you don't detox, you have more things like estrogen dominance and symptoms and, skin issues and bloating and all of these things. And it's like, that's why when we talk about, yes, we can put you on a supplement that'll help detox your liver, but like if you're not addressing a deeper rooted anger, that actually can make you more toxic, it's
Yeah.
truly, um but yeah, that's a whole nother rabbit hole.
And
um
then they'll come and they'll say, I got so angry at my family, and now I'm ashamed and I'm overwhelmed, and now I'm eating for comfort.
oh my
And
God.
they'll come crying, and I need you to help me feel better, Maureen. I read, that I should do something about my periods, because maybe it's my period, and maybe I am depressed. I want give me anything that's going to make me feel better, because I hate myself right now, and I want to have a beautiful relationship with my family. I want to do all these things, and just what can I do? And I think sometimes too, for me, the answer is more simple than they want, because sometimes it's like, yeah, I will, if you want a little baby dose of SSRI right now, and you
Mhm.
would like to try some estradiol and a very low, the lowest dose I could possibly give you of progesterone. If you want to try that, we can. But I'm also here to tell you that, like, you have to go to bed earlier, and you have to eat more protein, and yeah, and you have to have water, and all
Mhm.
of those things are actual medicine. So, like, the script is these things, and they are not pleased,
I
because again, I think that we all have been preconditioned that they're advocate for yourself. Self-care is going to the doctor and getting that medication.
yeah.
So that's another thing that has to go in the fifth grade book.
Well, and it depends on
Pills aren't
what
going to
they
save
do.
you all the time. You need other things.
Well, and even if they do, like, do you want to be on them the rest of your life? Because chances are, if you're feeling depressed, there's other things going on too. How are your joints? Your joints hurting a little bit? Are you like weirdly achy all the time? Are you,
Right.
do you have all these other things kind of going on? I think that's what we need to understand too. But yes, going to bed, put some blue light blocking glasses on so you can sleep better and your melatonin, your serotonin, you like are just functioning a little bit better in the AM.
Yes.
We take the circadian rhythm is so important in female health too. We really underestimate that.
Right.
The power of that. Yeah, drinking, stabilizing your blood sugar so you don't feel crazy. You don't get these huge dips. Like that's a
Right.
huge one with anxiety and kind of more depressive like symptoms, right?
Yep. That goes in the fifth grade book too. We need to
Yes.
show the girls a video. You know how there used to be those videos like, this is your brain on drugs. This is your we need to show them, like, what were those called, like cautionary statements or whatever, of like, this is who you could become if you don't prioritize sleep. You know?
Well, what's so fascinating about sleep too? Well, there's so many different things, but it
Yes.
messes with your hormone signaling, your ghrelin and your leptin, right? So people think they're crazy because they're craving food all the time. They're not full, they're having these hormone symptoms. It's like, well, actually, this is a physiological response. This is not necessarily a mental, like your body's literally like if you don't sleep, your cortisol's higher. Your hormone signaling is different. You're going to feel less full, more hungry, right? It's like all these things are happening. And then when you get into perimenopause, it's a whole nother beast because your insulin sensitivity changes, your, sensitivity to cortisol changes, and you're just fighting an even more uphill battle of that. So you
Yes.
really have to solidify those habits now. But again, those are things they seem basic. I've had so many people be like, I've tried it all. And I'm like, but all is not the supplements. Sometimes it's not doing more, it's being more. And it's just doing kind of the right things, turning the brain off a little bit and just getting back to the way our body was supposed to function. And then we can kind of
Yeah.
do things, right? And medications have their time and place too, should you need to do that. But if you're not
Hmm.
first, I just had a client come into who's perimenopausal who, we actually work with a company that does some HRT. Like I can't obviously medically do that. I'm a component for the right person. And I said, listen, we're not going to jump to that first because your body is very inflamed right now. You got a lot going
Hmm.
on first. Let's do this first. And then let's explore that down the road, and see if this helps. But if we just throw that onto an already like fueling fire, no, we're setting your body up for you might feel a little bit better, right? But your body
Hmm.
can be fighting a bit of an uphill battle. So do the right things, do those basic things first. Let's get your body in a healthier.
And there's no question how many patients have come to see me for their 90-day follow-up after starting menopausal hormonal therapy and are disappointed.
Yes. Oh,
And they're
oh,
like, well, I was like, they're like, I felt worse. And I'm like, right. And again, sometimes it can make you feel worse if you're inflamed and you're really not doing all the other things. It's fascinating. And the ones who feel the best are the ones who are doing all the things and are
mhm.
really, you know, nutritionally kind of balanced and hydrated, and attempting to get good rest and attempting self-care. The ones that are like, I heard I need a patch, so I'm nicer to my family. I'm like, yeah, I'm going to give you this. But again, just like you were saying, it's like we need to give quick information. This handout I give them is 7 pages long. I mean, I sometimes I think they're already overwhelmed. They can't even read past the first paragraph.
That's such a that's the biggest thing I see with clients, hands down. I get asked all the time, and I'm like, it is nervous system overwhelmed. We are chronically overwhelmed that we want the information, we want more, but at the same time, when we have it, we're like, we can't process it, you know? And that's tough, and I don't blame them. I was there too. And so simple things, to just retrain that nervous system just to chill out a little bit, then you can take in more information. But with the patch, it's so interesting because it's so hard, I feel like, I'm sure as a practitioner, to meet them where they're at and sometimes give them what they want while also understanding that, like, hey, this might not be
Yes.
the best thing. It's just like this, I feel like this tightrope that you have to kind of walk on sometimes.
Yeah. And the empathy is huge because like some of them are like, you were wrong or you didn't help me. And it's like the worst feeling in the world. And I don't have that backbone. I'm not that tough where, I feel for all my people and I want them to feel better. I want whatever I'm going to tell them to help. And when it doesn't, I feel so terrible. And I think then for me, as a person, I can feel my cortisol level go up and my stress hormones rise. And, all I want to do is go to my office and eat some chocolate like in between those patients. And so it's so funny. Now I've like trained myself to grab for my water bottle when I'm feeling that way and just like take some breaths and like pound on my chest a little bit to like get myself ready for the next patient. Um, and really remind myself, like envision like breathing out kind of like anything inflammatory. Like, and I tell patients all the time, just picture drinking water and it's rinsing all the bad things out of your body. And when you go for a walk, just visualize little ninjas in your body, healing your cortisol, all the bad things, just visualize. So I'm trying to do, you know, that moment to moment, I think in between patients, because sometimes I can really feel it.
I'm really glad you mentioned that because I've actually had multiple people come on here who are healthcare providers talk about the health of healthcare providers because you have to stay healthy and grounded too, and
Yeah.
because you don't want that energy to also seep into that next person too. And that's very difficult when you're seeing people back to back, and a lot of people
Mhm.
in a day, especially those ones when you're empathetic. I am too. And it's like, oh, you like want to help somebody so bad and you can only help so much too within your scope of practice and within what they're willing to do too. If somebody's comes to you saying things didn't work and they were like stressed out or had a trauma or just also decided to eat pizza every night. Okay, yeah, it's not your fault.
Right.
But there's oftentimes other things going on, but you have to ground yourself too and understand like this is not a reflection of who you are as a practitioner, right? And your
Yes.
knowledge. Sometimes things are everybody's just a little bit different.
And I just bought some lemon balm tea to
Love,
keep at
love
the office because I was like an acute little like I like to drink tea out of a cup, like not a like to go cup, even though I love a to go cup, like a great
it.
Yeti or something to like keep my water cold or whatever.
Mhm.
But I was like, no, no, if I'm going to be compliant, like if I'm going to do this, I'm just going to have it so it's hot and I can pour it and drink a couple sips while I'm like charting and then go to the next patient. So I did it because I was like, this has to happen. Like
Mm.
I do not want to be a cliche. I do not. I want to be able to really practice what I'm preaching in terms of like self care. And at least right now, I can see and feel those benefits a little bit. And I think I just wish I had a surefire thing for each patient that gave them that like little instant gratification. Like, where, hey, take this magnesium. And
Mhm.
a day later, they feel better. And then they keep doing it and it's healthy. I just wish there was that magic something and they would feel better instantly. And then they would be like, oh my God, she was right. And they would keep doing it.
Yeah.
Someday.
Someday. Well, you know what though? It sounds so silly. I've had clients literally who I'm like, we need to drink 8 glasses of water a day, and that's life changing for them. And they're like, what?
True.
And I'm so much more energized and I'm less crabby and less hungry. And it's like, sometimes it is that simple and simple with like magnesium, or just have like a chicken breast an extra time a day just to stay, sometimes it is
Yes.
that simple, you know?
True. And you're right. And I can't let those, I got to remember those dopamine rushes I do get from patients who are like, yes, you're right. I've been eating more protein and it's absolute game changer, Maureen. You were right. Like,
Yep.
or I got the courage to go to pelvic floor PT and I cannot tell you how much better I'm pooping and how I'm not having this intermittent pelvic cramping anymore. And like, wow, I feel so much better. I have to remember that there's a lot of those rather than the ones that are like, nothing worked.
This is my little tip that I do is I write down little things that people say, or for me, I have, my things virtual. So I'll screenshot it. And when I'm having a down time, I go to that album and I remind myself of all of the other people, because some people truly also want to stay in victim mentality. And that's also like a really hard thing where it's like nothing's ever going to work for you because you want to stay in this victim mentality. You want to stay stuck, which sucks to
True.
say, really sucks to say but there's a certain element too where it's like no amount of HRT or magnesium or protein or sunlight is going to rewire this for you until you do some of the deeper work with, for me, I really like clients do like EFT tapping, motion code, IASIS, different like, kind of, therapies, but that's people don't really want to go down that route all the time.
Right.
Nobody's ever told them
No,
that, right? And so I know that's something I have to remind myself too is like, hey, have I done everything? Do I feel really good about what I've done? If it's a yes, which it always is because I over deliver for everyone, I like overthink about most clients. It's like, okay, then I've done what I can, you know?
exactly. And I feel like, again, that has to go in the fifth grade book too. Women we are wired to over deliver. Like you, you just tell yourself that there's a high likelihood that you over delivered and then you did what you could in any situation. I would say from you, I want to know if there, and this could be tough, but like 12 to 102. I said I take care of patients 12 to 102, right? What would be like three things or two things that you would want me to tell every female patient? Or I would say we could even narrow down the age group because I am taking care of a lot of perimenopausal, menopausal women who are coming to see me for kind of this transition period in care.
Mm.
What would be a couple surefire things that you're like, no, no, everybody needs this or these two things? What would you want me to tell my patients?
Just two or three things. I'm gonna lump them.
Yes.
I can't. Um,
Fine.
Under the nutrition side, we
Yeah.
talked about this already, but truly, I can't tell you how many people say, I've tried that already. But have you? Did you do it for a day? Did you do it for, a week, or have you been consistent with it, right?
Okay.
Water and protein we tapped on, but like
Okay.
most people drinking, I'm gonna say half your body weight in ounces, but that's a very relative. If you have maybe a little bit more weight on you, that might look a little different. Or maybe if you have prolapse or things like that, that might look a little different. But bare minimum, about 80 to 100 ounces of water a day. Filter
Mm-hmm.
through a good ass, excuse my language, good filter.
Yeah.
Good filter.
Yeah.
Not a Brita, all right? That's not going to do it, unfortunately. Filter your
Right.
water and put minerals in your water.
Mm-hmm. Okay.
That is like 101 that people are not doing, and that will change your life, your energy, your hydration on a cellular and mental and everything physical level, right? So
Mm-hmm.
I think hydration, but hydration is not just water, as I mentioned. It's also minerals, right?
Yep.
You can be dehydrated and drinking a lot of water, right? It has to get into
Yep.
the cells too. So that's where the minerals come in. If you have an RO system, put trace minerals in your water. You need to put minerals back in your water. But yes, just have a good filtered water and drink 80 to 100 ounces of water a day.
Mm-hmm.
Watch the fake water, healthy things like vitamin water and these sucralose sweetened health water. Watch that stuff. I'm not saying you can't,
Mm-hmm.
but things like overdoing the poppies and the smart what it's not always great for your gut. Okay. That would be number one. And then you mentioned protein for a very baseline knowledge, about 100 grams of protein
Mm-hmm.
per person. This is very
Good.
much going to change per person, but that's a very average, right? Unless you have severe gut issues and your body can't break it down or you have other, metabolic dysfunction, most people can handle about 100 grams of protein per day. If you tell me you're eating enough protein and you've tried eating more, track it for a day or two and understand how little you're actually eating. It's probably 40 to 50 grams a day. So,
Mm-hmm.
yes, you're
Okay.
going to feel tired. You're going to feel more edgy. You're going to feel, maybe metabolically or, physically not in the way you want to look, right? And it's going to also, I mean, helps with everything.
Mm-hmm.
Me too. Because when your body is just a little bit healthier, a little bit, you're going to feel better. Turn off your phone or wear blue light blocking glasses at night.
Mm-hmm.
That's a really big one because so many people struggle with sleep. And when you're not sleeping, you're not healing. When you're not
Mm-hmm.
healing, our body is more stressed out. That's going to lead to a lot of inflammation. That's going to show up as a lot of hormone issues. And just a lot of other issues. So, if you love to watch TV to calm down, at least wear blue light blocking glasses. So,
Hmm.
something like that. And if you can get sunlight first thing in the morning. So that way, you're at least addressing the circadian rhythm a little bit. If nothing else, I love red light as well. Sitting in front of a red light box first thing in the morning if you wake up too early and you can't get sun.
Hmm.
So I know that was three, but I'm lumping that into
Yeah,
one.
that's great. Yeah.
Because those are basic that everybody can truly do for the most part.
Yes.
You know, I think sometimes, I mean, red light, that's a little bit more of an investment, but those are the
Sure.
other things, if you can ground and get your feet in the grass first thing in the morning too, bonus and absolutely incredible. I personally hate the feeling of grass on my feet, but I love the benefits of it. But or sometimes it's too cold because we live in Michigan.
Yes.
But those, just grounding. So that would be probably basic 101. That's easy to put on a sheet of paper.
Yes.
Thing that most people need that are unwilling to look at it is the nervous system aspect of it.
Hmm.
And as somebody who's worked with thousands of women, I've worked in so many different aspects from, health and fitness primarily to functional health to, really deep rooted cases to now more, sometimes in the energy medicine sphere of things. I transitioned to that because it was like no amount of protocol supplements or even food are going to outweigh the fact if your body's not in a calm state, right? And I don't mean
Hmm.
like not stressed. Everybody's like, Shannon, I'm not going to be not stressed. It's not about how stressed you are, it's about how resilient your body is to that stress. And when your body's
Hmm.
under stress for too long, and this can happen from a trauma from a very young age too, right? It doesn't like this happens early on for most people and they just carry it on later, later and later in life. Your body will not heal fully. You can still feel better. You can still feel better
Hmm.
doing all of the things, but the missing puzzle piece to truly feel your best is understand that your body is probably stressed and that you need to work on, nervous system rewiring. And it doesn't have to be complicated. You don't have to go to certain things like therapy, or I'm a huge fan of therapy, particularly things like
Hmm.
EMDR. Um,
Yes.
EFT tapping is a great one you can do at home. You can download an app, do it on your own. There's so many different modalities to kind of help rewire the brain that are simple. Breath work, box breathing, is a big one you can just do throughout the day. Just something to let your body know, hey, I'm safe. The way we talk
Yes.
to ourselves, especially as women, and not hating ourselves and not constantly putting ourselves down. And are we putting other people before us? It's like we have to rewire that brain to help our body be like, listen, you're not gonna die. You're not gonna run from a tiger, right? This is all, evolutionary too. It's like we're not.
Hello. Yes.
And through that, I have seen the most amount. I have seen fibroids disappear. I have seen cysts disappear after all of the supplements and the protocols and all of the jazz
Sure.
through energy healing and through nervous system rewiring, because that's, trauma stored in our body. And there's
Yes, it
a
is.
lot of research on this now, which is beautiful because it really wasn't that way, if, a decade ago. And that is really like, that's hard to put on a sheet of paper. Like, do therapy, everyone knows of therapy, but you're not going to say, do EFT tap. What is that? Do breath work, right? It's like, okay. And I'll tell you, as somebody who that was the last piece of my puzzle too. I did all the
Sure.
nutrition, the fitness, the supplements, all of it.
Yeah.
I understood this was why my body wasn't fully healing.
Right. And I feel like it can be simple where the good type of hydration, the protein, and you need to say something nice to yourself every day,
Yes.
and you need to try to get sunlight first thing in the morning and ask for a little baby red light for Christmas.
Yes.
Like I feel like that's doable. Like in my, I making sure I'm up keeping them up to date with their pap smears and their
Yeah.
breast health
Hmm.
and, all their screenings and, really again, I think a lot of doctors overlook like they're like, "Oh, she just needs her bone scan at 65." And it's like, "No, she needed her bone scan at 60 because that's when she was menopausal for 10 years and that's how long it's either 10 years from onset of menopause or age 65."
Hmm.
And nobody ever paid attention to that. And now she's fully osteoporosis, and we've missed this opportunity. So, you
Hmm.
know, in the midst of doing all that, making sure they're up to date on that. And I always tell my boys that I'm like an FBI agent for all the lady parts, and it's my job to protect the women and keep them healthy and strong because we, keep the world going. And they were really able to buy into that. But I think after being the FBI agent, I can at least say those things. And like you said, it can make a big difference.
Oh, yes. Yes. I feel like we could
Yay!
really talk for like 3 more hours, but I am going to wrap this up and please let us know where can people find you? I know that she's located in Michigan and Ann Arbor and
Yes, and I feel like that's where I am, and I love it. I love living in Michigan. I thought I would hate it, but yes, I am. I am with IHA, Trinity Medical Group. I see patients at our Domino's Farms location in Ann Arbor, and you can Google Maureen Westfall IHA, and it'll pop right up my office info, my contact info. I love taking care of women, and I take care of them inpatient and outpatient because I round on our delivered patients on the weekends too, and I love it.
ah, there's so much that you offer, and I know again, I don't. Are you taking new clients? I know you're.
Yes, always. Yep, yep. What's nice is I'm surrounded by the universities here, and so there's always this nice revolving door of
Okay.
where my gals get grow up and go out into the world. So yeah,
Mhm.
I'll always really be able to do that. I think for quite some time because of where I am.
Oh, that's yes. Well, I guess yeah, Ann Arbor, right? Um,
Yeah,
Amazing. Well, thank you so much for your time. I feel like this was an incredible conversation. Um,
same.
if you found this helpful, I would absolutely love if you guys listening, shoot me a message. I love hearing if people have little, takeaways, nuggets, leaving a review or sharing this with somebody that, could really benefit from it. Always helps spread the word as well. But thank you, Maureen, for being here. Thank you, listeners, for being here. And we will catch you on the next show.
Great. Thank you so much for having me, Shannon.
Bye.